and I am pleased to bring to you our second installment of Community Conversations. One of the things that we felt was an important venue was to reach out to the public to provide educational opportunities, and we thought what a great place is to bring people in here. So along with Don Broughton and myself, we're trying to come up with a calendar for community conversations, and tonight's topic is maintaining a healthy heart. I do have next month's topic already. We're actually going to have two topics in the month of March. The first one's on concussions in youth sports, a very important topic, and we have the athletic trainers at Meadville Medical Center and Dr. Teresa Wheeling talking about that. And then 2 weeks after that, on March the 24th, we are having the dietitians and, fingers crossed, along with Dr. Gailey, one of our orthopedic surgeons, talking about bone health. So again, we're trying to get relatively informative conversations, not lectures. We want this to be an informal environment, so please, if you have any questions, don't hesitate to ask. But tonight, with regards to maintaining a healthy heart, I'd like to introduce Dr. John Wilson as our Ask the Expert speaker for tonight's community conversation. Dr. Wilson graduated from Penn State a few years ago. He interned in Boston and then did his fellowship in interventional cardiology at Duke University in North Carolina. We are absolutely thrilled when Dr. Wilson and his wife Kelly and your son Dick moved to Meadville around Christmas time or in December of 2012. He's been an amazing addition to our medical staff, and speaking on behalf of someone that I hold near and dear, who's benefited from Dr. Wilson's care. So thank you all for coming, and Dr. Wilson.
Thanks. So this is going to be casual, okay? It's whatever you guys want to talk about. I have a few things that I'll say up front. What we wanted to talk about is how to keep a happy, healthy heart. But one of the things I did want to talk about first was how your heart doesn't get so happy. And some of those we can control, some of them we can't. I'm going to talk just real briefly about what happens to the heart over time. The heart is simple. It's interesting. The orthopedic people joke with us and say, I have to deal with 100 different muscles. You have one. I have the heart. That's all I do. One muscle. It's pretty important, though. It feeds all the other muscles. But that's all the heart is. It's a muscle. It's a muscle supplied by plumbing and electrical. Very, very simple. But ultimately, everybody dies because their heart stops. Everybody dies because they have a cardiac arrest. We need to prevent that. Prolong life, we need to do things that we feel like we should be doing. And I'm not God. I have my hands, I do what I do, and we all live through life and prolong, hopefully, good life for people. So, a couple things I want to talk about. First, risk factors for coronary disease. Some of them we can deal with, some of them we can't. Right off the bat, if you have heart disease in your family, you pick the wrong family. You can't fix that. Someday you can. Gene therapy is going to fix that. But we can't fix that. So heart disease at a young age, I always ask patients or people, anybody in your family with heart attacks, stents, bypass, 40s, 50s, 60s. And it depends a little bit on if you're male or female when you had that happen in the family, but I'm not going to get into the details of is it 45, 50, 55. Generally, if somebody in your family had a heart attack in their 70s and above, that's just life. That doesn't mean you're at risk of having that. But if you had a brother that had a heart attack when he was 40, or a sister that had a heart attack even that age or even a little later, that's significant. So we can't change genetics. It is what it is. Other things, the classic things, smoking. The one thing you can do something about, the one thing that causes incredible injury to the walls of the arteries is smoking. nicotine, not just smoking, but tobacco in general. Even chewed tobacco does the same stuff, it just doesn't hurt the lungs. So smoking is one of the things we can fix. Diabetes, people get afflicted with diabetes. Okay, we deal with that. Diabetes is tough on the blood vessels. Very tough on the blood vessels in the heart and the rest of the body. So that's one of the things that is a big, big risk factor. High blood pressure, why? It just pounds the arteries, causes damage to the inner wall of the artery. Now you can start to form plaque inside the artery. Plaque is not the same as under the teeth. Plaque is cholesterol buildup that we'll talk about in a second. So hypertension is one of those things that can increase your risk, of course. I always tell patients, people, myself, my dad, my brothers, my wife, hypertension is only bad if you have hypertension. So if you can bring the blood pressure down, you've taken away that risk factor. Not so much with diabetes. We do know if we can control the sugar, we bring the risk down, and we have to do that, and it's very important. But that's a lifelong process. Just like coronary disease, once you have plaque buildup, it is not. It's a lifelong disease. It's not curable at this point. Okay, we can slow it down. We can stop it in some cases. We can't necessarily reverse it. You start developing plaque very early in the arteries. They've done, unfortunately, autopsy studies in people in their teens that had car crashes and things. And even teenagers start developing these fatty streaks in the aorta, where you have cholesterol starting to build up, even in your teens and 20s. And that's the precursor of coronary disease. So all those things are risk factors. They start early. When you start worrying about cholesterol at age 50, it might be a little late. So I think we're more aggressive at looking at cholesterol and things like that. So cholesterol is another risk factor. Obviously, high cholesterol. But it's interesting that about 30 to 50% of people that have the big heart attack that come in have cholesterols less than 200. So it's not just about the numbers. It's about what your body does with the cholesterol and where it puts the cholesterol and how it gets there. Some other lesser known risk factors, but things that we can't measure. Stress. Okay? Stress. I can't measure your stress, my stress, your stress. You can't measure stress. I can measure blood pressure, how many cigarettes you smoke, what your cholesterol is, what your A1C is. I can measure all that stuff. I can't measure stress. Okay, so stress is felt to be a contributor. It's easy for me in the office to say to somebody, well, just don't worry about it. I don't say that because I know that doesn't work. Stress is real. And so stress is one of the risk factors for coronary disease. In fact, the most common time to have a heart attack is Monday morning between 6 and 12. Okay? Why is that? Your body's revving up, getting ready to go to work. All of a sudden your adrenal glands put out epinephrine, which is adrenaline. Put out steroids, basically, is what your adrenal glands put out, get you ready for the day. And Monday mornings, of course, if that's your work week, is a bad time. And then you put in a little snow shoveling in there to get your car out on a Monday morning, and there you have, yes, ma'am.
We know a retired person that had his heart attack Monday morning, and he wouldn't be going to work. Is there any reason why somebody that's retired would have a heart attack Monday morning?
Monday mornings, we don't know. I mean, it's chance. 1 in 7 days it's going to happen. But that is the most common time to have a heart attack. It has nothing to do with Mondays. I think full moons have a lot to do with everything. I never know there's a full moon until I have a really, really bad day and night, and then I look up and I'm like, oh, it's a full moon. So that's where I do the opposite. I never track the full moon. But there's a lot of things that go into it, and I don't know exactly how to answer that, but the point is that the higher stress situations produce high blood pressure. They produce the heart pounding against arteries. Now you can cause a problem inside the vasculature that can cause a heart attack. And when we talk about the vessels around the heart, I don't even have anything close to the size, but if you took a pen in your pocket apart, the little tubing inside the pen, That's about as big as the arteries are around your heart. Maybe just a little bigger than that with some people. So it doesn't take a whole lot to mess up the plumbing to the muscle that provides everything to the body. So those are some of the things that can lead to badness. Stress I talked about. Obesity is another one. Obesity is interesting because obesity leads to higher cholesterols. It leads to hypertension. It leads to diabetes. So we don't know if obesity in and of itself is a risk factor because it draws everything else in. So again, you can't measure necessarily obesity in any one person and whether or not it's a risk factor, but it goes along with coronary disease for obvious reasons because it brings in 3 of the big risk factors, which is cholesterol, high blood pressure, and diabetes. And then, of course, I talked about smoking. So those are the main risk factors that we deal with. What happens is when all those things start pounding the arteries, you start forming cholesterol in the walls of the arteries. You start depositing cholesterol. And for a time, the vessels do okay with that. The vessels actually expand. So when we do a heart cath on somebody and we inject dye down the artery, we can say everything looks clean, looks fine. That artery may have expanded with cholesterol buildup to keep the central channel open. Okay, your plumbing at home doesn't do that. Your plumbing just clogs. This is elastic. It can expand, and to a point, it does that. And it's called remodeling, and positive remodeling, where the vessel expands. After that happens to a certain point, it can't expand anymore, and you start getting encroachment, just like you do in the pipes at home. So that's what happens. Now, in the wall of the vessel, the cholesterol is irritating to the blood vessel. Okay? So white blood cells come in. White blood cells fight infections. They're very aggressive at doing things. White blood cells start putting out what are called Metalloproteases. It's a big term. It basically is an enzyme that starts dissolving the inner lining of the blood vessel. And when these Metalloproteases come in and you dissolve the inner lining, all of a sudden that plaque ruptures. And the way I like to describe it, it's like a kernel of popcorn in the wall of the artery. It's just sitting there, sitting there, sitting there. All of a sudden, boom, it's taking up space, and your body tries to heal that. Your body has no idea what just happened there. And the main thing that your blood vessels or your blood cells do is to try to prevent you from bleeding to death. So they don't know if that rupture came from the outside in, like a shave, or the inside out to put the blood clot there. Okay? So that's what causes heart attacks. That's what causes unstable symptoms. It's not the same thing as somebody just building up a plaque over time. Now I'm getting more chest pain, short of breath, treadmill's abnormal, whatever. These are people that come in, all of a sudden we're doing fine, and boom, I had a heart attack, and a little different story. But that's what cholesterol does in the walls of the blood vessel. And so we have ways of decreasing that inflammation, decreasing those white blood cells from doing their bad stuff in the wall of the blood vessel. So, any question?
What about people who have low blood pressure? Like I know somebody that had 96 over 45.
So low blood pressure isn't associated necessarily with heart disease. Sometimes we do that with medications. We overdo things. I'm a heart guy. Okay? I want your blood pressure through the floor. Because that means nothing's being stressed. So if you're 90 over 60 and you're not getting dizzy, lightheaded, passing out, your heart's working very efficiently. It does not have to squeeze against high blood pressure. So that's why exercise and other things that we'll talk about, exercise basically allows your muscles to get more efficient. So the muscles now don't need as much oxygen and the blood pressure stays lower. And so you have less resistance to flow out of the heart. It's very simple. If the heart doesn't have to squeeze hard, it doesn't use a whole lot of energy. And the energy that the heart uses is, the same thing that we eat every day. It's, it's carbohydrates, it's fats, it's proteins. That's what the heart uses. We can go in excess one way or the other, and we can talk about that But that's basically why we want to keep blood pressure low, cholesterol low. We want to do everything we can to improve the system, if you will. So does that mean everybody in this room has to get out there and jog 100 times a week and 6 hours a day and get out there? And it's been kind of interesting. I just wanted to show on this board a couple of things. I can actually use the same, because I'm not a very good artist. But all I'm going to show you is one thing, and then you'll see what I'm talking about. That's my art. It's not a tongue. It's nothing. Moderation is what we're talking about for most of the things we're talking about. So going crazy about reducing your salt intake. Okay, I'll start with that as an example. If you have heart failure, weak heart muscle, there's a problem, you have swelling, you have reason because the heart can't keep up with the squeezing, then yes, we want to restrict the sodium. So the levels at which we're told to reduce sodium, I'm just going to say 2 grams here. Okay? The bad American diet is here, 10 grams of sodium. If you drink a 12-ounce can or a 12-ounce thing of tomato juice, you've already hit this for the day. Okay? So 2 grams of sodium is pretty tough to stick to. This is somewhere around 3 to 5 there. Okay? If you look at mortality, patients dying, patients do the best at this. People do the best at this. The American Heart Association says we should all be doing this, and the people that are over here overdoing it, it's the same. So moderation, okay? I'm not saying don't eat low salt, because it depends on the situation. If you have high blood pressure, sometimes people are very, very sensitive to sodium, so you need to have a low sodium diet. But what I'm trying to show you is that the lowest is not always the best, okay? Does that make sense? If you start looking at things like, you guys, you two in the back will hate me for this one. There was a study that came out yesterday in out of Copenhagen for exercise. Okay, it basically said if you do 0, you're here. If you do very strenuous, you're here. And if you do moderate exercise, you're here. The lowest mortality is in moderate exercise. This is jogging. Okay, this is an interesting finding, and it's not controlled. Wasn't randomized. It was just basically an observational trial. But again, moderation is the key. You don't have to get out there and jog 15 miles a week. You have to just do something. Okay, the American Heart Association (ACC) right now is basically saying that the recommended amount of exercise is 30 to 60 minutes of exercise 5 days a week, and 7 days would be even better. That's very different than what I used to tell people, 20 minutes a day, 3 days a week. That's all you need. The key here is the strenuous part. This is fast jogging versus maybe the same amount of distance at moderate or slow jogging. It's very interesting. So I don't even know what to make of this. This popped across my desk last night, and I was reading the trial today, and it's observational, but it tells me again, it's moderation. Okay? Same thing with salt intake. Same thing with just doing stuff. Don't go crazy one end, the other end. Do something. Do something, routinely, and you end up in this category of the lowest mortality. So. The pendulum in cardiovascular medicine, as you guys, I'm sure, are aware, just goes back and forth. Everybody should be on ice, and nobody should be on ice, and everybody should be on ice, and nobody. It just goes back and forth. And so I think we have to be a little bit curious about trials like I just told you about, this one. But it makes sense that at least some moderate exercise for most people is going to keep your heart healthy. It just is. It does exactly what I said.